Good morning. Thank you for joining us for today's webinar, Hiring TNAs to Convert to CNA. I'm Wendy Johnson with the Pennsylvania Healthcare Association. Before we begin, I have a few housekeeping items to cover. PHCA offers monthly webinars to members to receive updates from department staff on regulations, learn from industry experts on current trends and practices, and to gain a better understanding of practical application tools to equip you so that you may continue to provide the highest level of quality care possible. This webinar is being recorded and will be made available on the PHCA website. The webinar is informational and not for credit. A survey will be launched at the close of the webinar. Your feedback is important to us and our presenter, so please take a moment to complete the survey. All attendees will be in listen-only mode. However, throughout the presentation, please feel free to submit your questions using the questions pane on the right hand of your screen, and our presenters will address them throughout the presentation today. Today's webinar is being presented by Chad Schaedler, Chief Revenue Officer with Cinematic Health Education. I'll now turn the webinar over to Chad.
All right. Well, thanks, Wendy, and thank you, everyone, for joining. I really appreciate the opportunity to share the work we're doing to help organizations as they work through what is, as we all know, a very difficult time in the industry and in the country in general. So I'm excited to kind of share our approach. I'm also very excited to be partnered with PHCA on this endeavor and really, appreciate all the work that they are doing. So thank you, Wendy. I am, as you said, Chad Schaedler. I'm the Chief Revenue Officer. I also have Tess Sturton on with me once this is concluded, and as we'll certainly answer questions today, and I do want to encourage you to ask questions. Unfortunately, because it's a webinar format, you need to type them in, and there is a question. You can see a question tab that allows you to do that. And I know Wendy said she would monitor that for me and ask any questions as we're moving through this. So with that said, I want to introduce who we are, kind of where we come from at Cinematic Health Education, talk a little bit about, what are the requirements of a TNA, and then how do you help a TNA become a CNA? And then I'm going to dive into our program to show you how we support you in that endeavor. But again, please do ask questions as we go through this. So just to give you a little background in who we are, Cinematic Health Education, we were founded in 2018, and we were founded by an administrator of a skilled nursing facility in Kentucky, as well as another individual who came out of the education technology space. And, this was really the brainchild of that administrator. And this is pre-pandemic, as 2018. But the idea was, even before the pandemic, we all had lots of issues hiring CNAs and finding good quality CNAs. And while there are a number of factors that come into retaining CNAs, one important element that he saw was that new CNAs weren't equipped for the job. While yes, they had the content knowledge that they needed, but that wasn't what made them, one, understand the role that they were about to walk into, and two, to be good at that role. And that's where he was thinking about, how do you teach the soft skills and at the same time prepare them for the good, the bad, and the ugly of what's coming? And that's where Cinematic Health Education came from. Really to address that area to help retain employees, and then to meet the unique challenges that the demographics of our target population really have. And that's where online really comes in to help with that as well. So that's kind of a quick kind of background of where we came into, how we came to be. And then as we entered the pandemic, the fact that we offered an online program obviously was very helpful to CNA programs around the country, But as we looked at, the growing shortages and so on, we decided to create a TNA program as well as a TNA to CNA bridge program. And that's obviously what we're talking about today. So quickly, Pennsylvania's TNA requirements, to become a TNA, someone needs to take an 8-hour temporary nurse aid training program, which has to include prevention of resident abuse and reporting of abuse, as well as a 50-question test at the end of the 8 hours. And students have to get an 80th percentile or higher to then be deemed a temporary nurse aid. And so from there, they can work on the floor. And I'm sure a number of you already are utilizing TNAs, although I know from my experience with other states, that tends to be very organization specific. So some of you may be well aware of these requirements, others may not. So once they have, a student an individual has taken that program, passed that test, then they require 80 hours of on-the-job training before they can sit to become a TNA. And that 80 hours of on-the-job training is really, it's really not well defined, to be honest. So, but what I know that our partners have found is that, they do need quite a bit of hand-holding. So it's something to be prepared for, because it really is on the job training. So unlike a CNA that comes to you that has quite a few skills already, you will find that TNAs typically do not, and so they're really going to need more guidance. But the nice thing is they do fit into the ratios that you're required to keep. So that's obviously a very big help. So once they have this on the job training, the employer, in conjunction with the TNA, needs to submit an attestation form, which you can get from the state, from the Department of Education, that attests to the competency of that individual. Once they have that, and that has to happen within 4 months of the declared end of the emergency. So there's certainly some time, unfortunately. We all wish this emergency would end, I know, but there is certainly some time. So, but once that attestation is completed and submitted, the TNA can then schedule their exam with Pearson VUE. And they have actually 24 months from the time they become eligible. So from the time that attestation form is completed and submitted until they need to pass the test. So that's just a quick overview into the Pennsylvania TNA requirements to then become a CNA. Now that said, I have also seen, and maybe some of you have experienced this if you've had some TNAs go through the process, that if they are not adequately prepared, they will fail. And just to use a statistic from the Board of Nursing in Virginia, and this is a little bit old at this point, I believe this was up until August, they have a 20% pass rate, which is very, very low, where a typical, someone coming out of CNA program, typically those pass rates are in the 80 to 90, low 90s. So very different. And that's really attributed to the fact that these folks weren't preparing for the test. They were simply doing their on-the-job training and then going in and sitting for the exam, which is not effective. And that's certainly been well established. So there are two parts to the Pearson VUE test. And I'm sorry if you guys are already well aware of this, but there's a written exam and there's a skills test. What we're going to talk about today is the written exam and how to prepare for that. And that's where our TNA Bridge course comes into play. Designed for adult learners, designed to be highly engaging by using a story-based, actually a movie approach, which I will show you. Also, it's designed to be asynchronous, so very easy for you to implement. It's simply, you can give it to the student and they can do this on their own. It's 30 hours, as I said, it's online, so they can do it, and it's device agnostic, so they can do it on their phone, they can do it on a laptop, a tablet, they can do it on the bus on the way to work. They can do it, whenever, wherever, which of course is the joy of online. But then the other aspect of this is skills training. And that's something we do not do. While we do model some skills through our program, we don't actually teach the step-by-step process that a TNA is going to need to pass when they sit for their Pearson VUE CNA exam. So that is something that needs to be provided at the facility level. And it can be, it can be another CNA, someone who's gone through training as a CNA could provide that. If you happen to have a state approved instructor, that's obviously the best individual to do it. Or, it could really be anyone. And the nice thing is that there are step-by-step guides for each of the skills that a TNA will need to know in order to pass the test. But I want to emphasize that is an area that is very important, because if they fail the skills test, they fail the test. So they can take it again, but they will need to. So yeah. So I don't know if there are any questions at this point before I jump into a demonstration of our product.
We do have 2 questions right now, but again, if anyone has questions, please feel free to type them in. I will give you the first one here. It is, exactly where do we get the attestation form?
So it's on the, and I can send this out later, or ask Wendy to send it out, but it is on the Department of Education's website.
Yes, I can include that in the follow-up email for sure. So yeah, that would be great to have that link for everyone. Okay, the next question, how many times can a TNA take the test in order to get a passing mark?
So I'll be honest, I have not seen that noted in the Pennsylvania regulations. I know there in some states it has to be within 3 attempts, but I did not find that. I haven't seen that in the Pennsylvania regulations. So I don't want to say there is no limit, but I didn't see a limit.
Okay. And the next question, where on Pearson VUE can we sign them up for the test? I can't find an area to sign up an account for them.
So let's see. So here is, so I've pulled up and I believe you can see my screen. And here is the Department of PDE's page on this. And if you see, you've got the attestation form here, frequently asked questions. There's the link to the Pearson VUE portal is provided, and then directions for creating a Pearson VUE account. So all of that is on the PDE website, and this was updated, within the last month. So it's very recent information. And this is the link that I'll share. Or actually, you know what? I can probably put this in the chat, can I? Maybe, yeah.
I believe so, yeah.
So let me put this in the chat right now. And I gotta send it to, actually, I'm sorry, I'm sending it to you, Wendy, because it won't let me send to everyone.
Okay, yeah, I'll include it in the follow-up email. So again, in follow-up to the question, we have, once you click on the link, there is no link to create an account on Pearson VUE. Following the direction, it says to create an account.
Okay, that's something we'll have to look into. And I don't work for Pearson VUE nor PDE, so unfortunately, I don't have that answer.
Okay, and we have a comment. Pennsylvania is 3 chances, I guess, to take the test within 24 months to pass the exam.
Makes sense, and that's what I've seen in other states, as I mentioned. So, great. Any other questions before I jump into the actual presentation?
Not at this time.
Great. So I'm now logged in as a student, And this is our curriculum. And we took the way we did this is we, as I said earlier, we started out providing content for the didactic portion of a CNA training program. And it's roughly 38 hours of content. And what we've done is we've broken it down into 2 separate sections for temporary nurse aides. And the first is that 8-hour program, and then the following is a 30-hour program. And what it does is it follows a new CNA, which of course I just, which I'm losing my arrows here. Sorry about this. So, well, it follows a new CNA as she works with 8 different residents, and we use a case study methodology this isn't what we want. What is going on here? My apologies. My computer just got real weird on me. Yeah, so I am sorry. I'm trying to figure out what's going on here. And I don't know, are you guys seeing this screen that just popped up on mine? Wendy, are you?
Yes.
Yeah.
Like programming language.
Yeah, I'm not sure what this is, honestly. And I'm not able to get rid of it. Let me see, does that change things? Okay, well, it does. So you know what, my apologies. So I'm gonna have to do that again. Log back in. So I have no idea what just happened there. All right, so everyone should now be seeing my screen properly. So what we do is, it's Marissa here on the bottom right, and we work with Marissa, or we show Marissa as she works with 8 different residents, as I was saying, each with their own health issues, but also their own unique personalities. And so we use this story-based approach in a case study methodology to teach all of the content that your TNA, well, first that they're going to need to be a TNA, and then that what they will need to be able to pass the written exam. So I find it's helpful to introduce the various characters before we move into how we actually teach the content. So let me do that.
It's my birthday. I remember my birthday. It's a friend. I mean, yours is. Story of Frank. You know the stories. Frank. It's my childhood. And it's Frank on the bed. His life changes in an instant. And really, in her prime. I did the whole trail up the whose life is about to change. And Ellen, whose grasp on reality is hating is not an activity. It is art. And Michelle, who has a reality all her own. And Stu, who's losing the only life he's ever known. No! Just loves her Jerry Todd. Busted! Same song. Yeah, that's going on. What I don't want It's impossible. Shut up, leave me alone. Go away. I know. But it's important. It's about making the residents feel welcome. They can feel comfortable. You can really feel the difference in people's lives. Good job.
So I think that does a pretty nice job of showing you, not just, who those residents are and how the story goes a bit, but also just the production value. And we actually created this with with the same person that does the Blacklist on NBC. So really high quality production value into it. So that said, how does this all work for you? And so in how we put it together, so there are tools built into this, first of all, for administrators, instructors, and so on. So there's messaging to your TNAs. There's 24/7 tech support for them to make sure that if they have any issues, they're able to get that support when they need it, and so on. So additionally, we track a bunch of other pieces that for the TNA and CNA to CNA bridge program aren't that important, but there is a grade book, so you can monitor their progress, make sure they're working through the system, and getting their 30 hours done or their initial 8 hours. You can see how they're performing and so on. And then, but what I'm going to do is I'm going to show you how we teach the content, and then I'm going to show you how we utilize the story. So I'm going to use Tess as, I'm going to use Lily as the first resident, and for her story, we meet her in an episode. So an episode is a piece of the movie, and the movie is roughly 3 hours of the total content, but it's broken down into small mini episodes. And while I'm not going to show you episodes with Lily, I'm going to show you those with Frank. We meet Lily in episode 2, and you actually just saw her. She was a young woman running through the stream and up the hill. She's actually a triathlete. But in that right after she's done running, she gets in her car in this episode, 28 minutes to the top, and she's in a terrible car accident. So she ends up in this skilled nursing facility for rehabilitation. So a couple of things before I jump into the other activity types we utilize. I'm going to skip around, but your TNAs will not be able to skip around. They're in a lockdown program, and very specifically because we utilize something called chunking and spiraling. This was very much created for the adult learner who learns very differently than our kids do. And so small bits of information delivered in context over time are the best way for adults to learn, unlike sitting in a math class for 45 minutes like we all did back in the day. The adult brain just doesn't work that way. And so we use this thing called chunking and spiraling. So everything we do, each of these buttons represents roughly 1 to 10 minutes of content, although most are about 4 minutes long, providing that, the right amount of information so that it can be easily learned, easily digested, understood, and analyzed by the learner. And then we build on it over time with more difficult concepts as we spiral up to mastery. So with our approach, and this is why it needs to be done in order, we aren't sitting down and learning infection control, for instance, in an afternoon, and so you can just do it all at once. We teach infection control across all 10 sections of this program. So again, just giving them little bits at a time, that they then over time build on until they master the content. So I'm going to use the second chapter here to illustrate the various elements of our program. So start with a quick introduction, and then we follow up with what we call a close-up video. And a close-up video is a video where we have an expert or experts speaking to the topic at hand. So let me play you a snippet of this one.
These are basically, vital signs are basically measurements of how a person is functioning in the crudest way. So blood pressure, heart rate, respiration rate, and temperature. Knowing those things, one knows, without even knowing anything else, if the person's relatively healthy or relatively ill.
Vital signs are literally that. They are what is vital to human life.
Well, vital signs is pretty much quote unquote the GPS of one's health. It's a very objective way of learning how well patient organ systems are working.
You keep track of a resident's vital signs.
All right, and I'm gonna pause it here, and I'm gonna pause it on Jamila for a very specific reason. And I chose this because I wanted to show you the broad array of experts we use. So we start out with a physician from Columbia's medical school. We have a geriatrician. We have an RN. We have dietitians, social workers, administrators. But most importantly, we have Jamila and two other actual longtime CNAs featured as experts. And we do this for two reasons. One, because they really know the role well. But two, because of something called learner-centered design. And the idea behind that is that students that see themselves in their learning are more engaged, which leads to better outcomes. And I think we'll all agree that our typical CNA can't really relate to the old man physician I started this with, but they can relate to Jamila, she's a CNA in Miami. And then we have two others featured prominently throughout this, but all in an effort to engage the learner more as they move through the program. So from there, we get into the lion's share of the teaching, which is done through in-focus videos. And an in-focus video is a digital video that allows for true multimodal learning by utilizing sights and sounds and music and simulations and graphics and so on to engage the different types of learners to make sure that they are learning the content.
If you've
so
been to the
play
doctor,
a little bit of this.
You've probably had your blood pressure taken. Do you know what the top and bottom numbers of a blood pressure reading mean? And maybe you know someone with high blood pressure, but do you know what this means for the person's health and wellness? The final vital sign we'll study is blood pressure, which is a measure of the force of blood moving through the artery when a person's heart beats. This is controlled by two factors. One, the force of each heart contraction. Two, the amount or volume of blood pumped with each heartbeat. Blood pressure has two measurements, each measured in millimeters of mercury, or mmHg. But what does this really mean? The first is systolic pressure, which is the period during the heart's contraction. Systolic pressure is the higher of the two numbers in a blood pressure reading. So, for example, in a blood pressure reading of 120/80, 120 is the systolic pressure.
All right, so I'm going to stop that there, as I think that gives you a good sense of how we convey the information. And by the way, Tess just shared with me that some of the sound isn't coming through great, and that tends to happen with programs like GoToWebinar. So as they degrade video and sound sometimes just for bandwidth reasons, but I will assure you it looks great on my end. So sorry about that. So we teach the content, and then we follow things with worksheet activities. And these are like little quizzes, and they're quick knowledge checks. And we want to make sure that, you know, our students are getting the information that they need, that they're getting the information, that they're retaining the information that they need as they move through. So these are quick. This one should take about 5 minutes. It's on vital signs. And while these aren't graded, students have to get these right in order to move forward. So I'll do 2 quick questions. So which is the easiest, most common site for taking a person's pulse? It's radial. I choose radial, says it's correct, we can move forward, but I'll get this next one incorrect. So 3 processes, breathing, heart function, and producing heat, are measured by which 4 vital signs? Well, we know cholesterol isn't one. We're told it's incorrect. We're told why it's incorrect. And now we've got to get it correct in order to move forward. So this one. So very quick, just designed to make sure that the student got the core concepts of what we were just teaching before we move forward. So from there, we get into Lily's actual care. There's an overview on injury, surgery, and musculoskeletal disorders. There's an in-focus on rescue breathing. We then get into wound care and infection control. There's an episode with Lily and Marissa, the new CNA, on observing and reporting, where Marissa recognizes that something's not quite right with her healing, with Lily's healing. When we address that, we have more on infection control. There's a close-up with experts on it. We get into positioning, rehabilitative, and restorative care. And then thankfully in chapter 7, we cover bed baths, but also thankfully transfers and discharges, as Lily gets to the point where she's able to go home. And we see that in episode 7, The Long Road Back. At the end of each section, there is a test. And while we initially provide some test-taking strategies so that they're able to utilize those throughout the program, and then when they sit for the actual test, and then we have a cumulative practice test at the end of each section. So this being section 2, it'll cover sections 1 and 2, all the way up to the final test, which is a simulated Pearson VUE 70 question test that they sit for. In this program, students need to get an 80th percentile or higher before they move to the next section. And again, that's because we're constantly building on their knowledge, and we want to make sure that they have the foundation down before we're adding more content on top of it. So that's a quick overview of how we teach content. I want to see if anyone's got any questions here before I go into how we utilize the movie to teach those soft skills and to better prepare them for what the role is.
We just have a couple more comments about the testing, which I can just read real quick. To schedule, once Pearson VUE approves the attestation, they will email the TNA with instructions to schedule. And then isn't the credential process moving from Pearson VUE to another provider? I believe this process is very different than before.
I will say that is not something I'm aware of. So if the state is moving in that direction, I wasn't aware of that.
Okay, give me a second here. We have another comment question here. Give me 1 second to pull it up. For TNA testing, there was a rule that you had 120 days from the time of course starting to test and pass. How does this rule affect the TNAs? Do they have a specific amount of time to test prior to not being able to be a TNA anymore?
So it was 120 days, but I believe that has been suspended so they can work longer as a TNA. And I believe that is laid out in that link I sent you, Wendy.
Right. And then how does a TNA send their attestation?
I am not certain on that.
Okay, we can certainly review that internally and try to get an answer on that.
All right, so let me jump in now with Frank and show you how we utilize the movie portion to teach. So Frank, we meet in episode 8, and Frank is which I'm not going to show you this episode just in the interest of time. And you may remember him from the trailer I started out with, but Frank is brand new. In episode 8, he's moving into the nursing home He is a real gregarious, outgoing, fun-loving guy, but he's also very sick. He has COPD, lung cancer, and heart disease. But I am going to pick it up in episode 9. So let me play you some of this.
Those hands.
Good morning.
Oh, hi, Marissa. Come on in.
Hey,
Marissa, good morning.
how are the Grafton's doing today?
You know, home and river.
Just keeps on rolling along.
You got it. Marissa. You know, if I'm not mistaken, your name means of the sea. Are you a mermaid, Marissa?
Big joker.
I can show you the world.
Nope. That's Aladdin.
That's also a classic.
Frank, is it okay if I check your temperature, your pulse, and then your breathing?
Sure, why not?
Okay, and have you had anything to eat or drink?
No, ma'am.
Okay.
No, I always wanted a magic carpet, but I could never afford one.
Frank, I need you to stop talking so I can get your temperature, okay? All right. Can you handle that?
Yes.
Okay. One more time. Okay. Take that.
You know, that was kind of nice, not having to hear my voice all the time.
It wasn't so bad.
Mm-hmm.
All right, I'll be back in a few moments, okay?
All right, now I'm going to stop that there. But there were a few things I wanted you to see. So one is I talked earlier about chunking and spiraling and how we teach little bits at a time. And also I mentioned earlier how we model some of the skills. So you're seeing Marissa, while we taught an intro to vital signs in section 2, now in section 3, we're seeing her actually take a resident's vital signs. But also very importantly, you're seeing how she's building a rapport with Frank, the new resident, as well as his daughter, Beth, which, you know, I think we all are aware, that's a really great skill for a CNA to have, to that relationship development. And then finally, you're seeing how she deals with an uncooperative resident. And while Frank's, you know, being very, very nice about it and he's joking, he's not letting her do what she needs to do in order for her to do her job, right? She needs to, and what she does is she very kindly redirects him while she's taking his temperature and gets him to do what she needs him to do. And that's the type of approach that Marissa models throughout this program as she interacts with the various residents. And that's, you know, so what your TNAs will be seeing and picking up on as they move through this program. So with that said, we utilize this, that particular episode to teach about reporting and recording objective and subjective information. So we teach what's the difference between subjective and objective. When should you report versus simply record? We get into common medical abbreviations. We then move into his actual care, so respiratory support. And there's an episode with Marissa and Frank on COPD. We get into his cardiovascular care, where there's an in focus on the circulatory system. We get into his cancer care, where we have an episode on infection control. And as I mentioned, we are constantly revisiting infection control. And then, unfortunately for Frank, he gets sicker and sicker. So chapter 6 is focused on care for a bedridden resident. And while we teach, you know, how do you care for that resident, we also have an episode on dignity. How can a CNA provide a level of dignity to a resident as, you know, their bodies are shutting down, they're unable to do what they used to do, you know, and that is a very important skill And that is something that we teach. We then, unfortunately, Frank continues to get sicker and sicker. And chapter 7 is on hospice and palliative care. And we have an episode 17 where Frank decides that he's ready. It's his time. And he recognizes it. And I am certain that most of you on this webinar right now have seen for yourselves what happens in those situations where, the resident's ready. He recognizes that it's his time, but his family doesn't. And in this episode, Frank's daughter gets very mad at him for giving up, but then she takes that anger out on Marissa as well as the RN on duty. And you see the conflict resolution skills that they need to bring to the forefront in what is a very difficult situation. And then finally, and unfortunately for Frank, we get here. And I'm going to play you 2 episodes in a row to show you how we deal with end of life. So let me play these.
Frank is getting close to the end. Our residents have rights, and it's our duty to protect them all the way to the end. The right to have a sense of purpose, to reminisce, to touch and be touched, to laugh, to be angry or sad, to hear the truth, to be in denial, to spirituality, and the right to be in control. When Frank goes, we cannot resuscitate him. That's his choice, and we must respect it.
Okay, in the next episode.
Hello, Beth?
Yes.
This is Nancy Fisher. Can you come down to see us? Hello? Hello?
Beth, we're going to give you some time alone. You can stay as long as you like. We're here if you need anything. Mr. Ed Sampson. That's the first resident that I lost. I went home and bawled my eyes out. I thought about quitting. I walked in to work the next day. I didn't know what I was going to do. And then I realized that the other residents, they needed me. And that's when I knew with this, this is all about. And that's when I knew that I could do this and do it well.
So not the easiest thing to watch, but I think it does a nice job of demonstrating how we teach empathy and compassion to our students, and how we prepare them for what, you know, is unfortunately a fairly common occurrence, and, you know, something that that's important. So, you know, as I said at the beginning, we really show them, you know, the good, the bad, and the ugly of what the role is to better prepare them. So with that said, you know, as you're looking to, well, first of all, it's a terrible place for me to end, and I apologize on the demonstration, but I think it shows you, you know, how that movie is intertwined and how important it is to the learning, and how engaging it is for folks. It really does keep them focused on their learning, as we have seen throughout the country. So that said, I'd love to open it up to questions. And yeah, so Wendy, I don't know if we have more.
Great, thank you. We don't have any questions at the moment, but thank you for this, to you and Tess for sharing this with us today. We are open for questions, so if anyone has any questions for Chad, please type them into the comment, question pane, and we'll get to them. Here, we still have a couple more minutes left in our hour.
Yeah, absolutely. And, you know, as I said earlier, while I wait for you guys to type some questions in, you know, we're really, you know, this is in Pennsylvania, you know, focused on how can you successfully convert, well, first of all, bring a TNA on board and then convert them to a CNA. And, you know, I want to stress the need to educate them for both the written portion and the skills portion in order for them to be successful when it comes to taking the test.
Great, so we do have some questions coming in. I will start. The first one is there a cost associated with this program?
Yes, there is. And, you know, working with Wendy and the folks at PHCA, we were able to come up with a very reasonable cost. It's $45 for the TNA program, and then for the bridge program, it's $325. So a very reasonable cost to help you get a CNA, if you will.
Great. Next question is, how do we gain access to the course?
So to gain access, you need to work with either me or Tess, and we can get you set up. And Wendy, I don't know if they have our email addresses.
They will I'll send out the follow-up email today. So I will make sure to follow up with you, Chad, and make sure I have all the information that we want to send out and include in the follow-up email for easy access.
Perfect, thank you. Any other questions?
Okay, is the 45 per individual or one-time cost?
No, that is per individual.
And again, maybe you did say this, but how many or how long? You know, what's the time frame? I guess everybody can kind of work at their own pace,
right.
Which is the beauty of the program, I would imagine.
Yeah, so it is designed that students work at their own pace, although, you know, we would I mean, certainly for the TNA program, we would encourage that it be done very quickly so they can get up and actually work on the floor. And it's a short duration. For the other course, our recommendation would be that they do it very close to when they plan to sit to take the test. And that way the information is as fresh as possible as they go in to sit for the exam. And they have access. I think you had a question about access, and we currently grant access for a year.
Terrific.
Yeah. So if they, so it really just depends when they're going to sit for the test.
Okay. Can you clarify the different, or the TNA program and bridge?
Yeah. So the TNA program is an 8-hour program. So it's 8 hours. It has to be completed prior to them working on the floor. Once they have completed that, when they are going to sit for the exam to become a CNA, and they've met the criteria, so they've worked at least 80 hours, the attestation has been completed by the administrator in conjunction with the student, they can then sit for the test. So that program is then 30 hours of content in order to prepare them for the written portion of the test. So, and as I said earlier, working to help prepare them for the skills, in your facility is vitally important for their success as well.
Okay, here's a question. Can they go back and review after watching it one time? So if they've watched it, they're a little fuzzy on something and want to go back, can they go back to rewatch it?
Yes, and my apologies for not including that. Yes, so once an activity is completed and you saw on my screen somewhere green, they can then go back, they can skip around, they can fast forward. At that point, it's no longer a lockdown system. So yes, absolutely, they can go back and review.
Okay. Does your TNA program replace the current online program?
Yes. So this was done, well, Wendy, I don't want to speak out of school here because that program was developed by ACA at the national level. But in working with the team at PHCA, they felt that our approach was much better. And if any of you have gone through that other program, I would assume you would feel the same after seeing what we did today. So yes, it does replace that.
Okay. And again, is the $325 per person cost?
It is.
Yeah. Okay. Let's see. There are a couple more questions coming in, so let me get to them. Some of these have already been answered. Okay, here's one. How is the TNA 8-hour course different from the free course online, which we just talked about? Because they mentioned two amounts. We have many TNAs already on the floor following the 8-hour course.
Mm-hmm. So we teach the same content as that course. We just do it in a different way. And it's, it's just a different approach that I think that if you have experienced that course, I think it kind of jumps out at you, the differences.
Okay. And can they just do the bridge course?
Yes. So if you have TNAs today who did the free course, you can absolutely do the bridge course. And we have many facilities that do that.
Okay, are there any other questions? These are great questions. We have Chad and Tess here for as long as we need them. So if you have any more questions, please type them in. And again, I will be sending a follow-up email so that everything will be at your fingertips. And then y'all can get in touch with them. If you think of anything else after we've completed the webinar today.
Yeah, absolutely. And yeah, please, we are more than happy to answer additional questions. If there are other folks that need to see what we do, we can do that. Absolutely.
Here's a question that's come in. So how does the course get to the TNA? Is it by email?
So yes, so it would be set up. So we have a process. So there'd be an administrator on your end of things. And that administrator simply puts their email address into our system. It then sends an email to the TNA or TNA to be, inviting them in to create their own account. So they log in, they create their password, their email will be their username, and then the course is there for them. And there's a getting started guide if they need it, which is, just a quick thing, but it's very intuitive, and our students tend to, jump right into it.
Great. Again, great questions and good information. Okay, here's a question that's come in. When you say this is replacing the free course, does this mean that you can no longer have future TNAs take the free course?
No, you'll have your choice. That free course still exists, and you can use that and not use ours. I mean, that's absolutely true. We just, as I said at the beginning, we created this as we had a number of facilities and organizations across the country that wanted something better.
Terrific. Again, any more questions? We'll give it another minute or so, and then we'll wrap up.
Yeah, absolutely.
All right, we just finished our annual conference here at PHCA, our virtual conference this year. We are starting to plan for anyone interested our Assisted Living and Personal Care Summit for March 22nd of 2022. So there's lots of twos in there, 22. So hopefully that'll be easy to remember. And we'll be, having more webinars coming out through the end of the year, so continue to look for that information. And we are planning already into the new year, which is hard to believe.
Yeah, it is. I can't believe Thanksgiving's right around the corner.
Exactly. Okay, so a question. So as an administrator, I will be paying for the TNA. So I contact you for each TNA.
Well, actually, you wouldn't even need to contact us for each. We would just set it up once, and then you could add TNAs as you needed to. So.
And then you would obviously provide a payment receipt for.
Yeah.
Would be a receipt that would be generated as a result of that.
Exactly. So yes.
Okay, here's a question. Are you going to be coming out with any courses that will have videos on step-by-step skills process, or is that already included in your current videos?
So we don't include that, but we don't have step-by-step skills videos. That said, and as someone mentioned earlier, which I am not aware of, but the idea that Pennsylvania is changing their approach to testing, because Pearson VUE does offer free step-by-step videos on YouTube that you can utilize with your TNAs. But if the testing service is changing, that may be changing as well. So those videos may no longer be accurate. So as I said, I had not heard of this change coming. So that's something that is obviously very important to understand better.
All right, great. Well, we're past our time. Again, if anybody does have any questions as I'm wrapping up here, feel free to type them in. As you're logging off, please take a moment to complete the survey. Your feedback is always welcome and important to us. Today's webinar recording will be made available on the PHCA website. If you're aware of anyone who can, take it, want to take advantage of it and need, want to view the information, please point them to the website under past webinars, and I'll have that up shortly, before the close of business today at the latest. So again, feel free to share that with anyone who may benefit from the information.
Great.
All right. I think we're going to wrap up here. Thank you again to Chad and Tess for your time today. We really appreciate having you with us.
Well, thank you, and thank you everyone for joining. We really appreciate the time, and Wendy, thanks for setting all of this up.
You bet. Everybody have a great remainder to your day and stay well.
All right, you too.